This is a short video over the axial skeleton, and I want to go over first the main bones of the skull. A prominent bone that makes up the forehead and the top of the head and the eye sockets is the frontal bone. Another bone you'll see is the maxilla. It's really two bones that fuse together here in the middle. So the yellow is the maxilla. And then the cheekbones are the zygomatic bones on both sides. Here's the frontal bone, and here is the parietal bone. So the parietal bone is attached to the frontal bone by a suture. And then you'll notice toward the back of the skull is the occipital bone, just like the occipital region you learned in exercise 1. Here's the temporal bone, and you can see more of it underneath, and it joins the zygomatic bone here in the cheek. There's a bone you see mostly from the inside, but you can see a part of it here, the sphenoid bone. Here is the mandible. It is also called the lower jaw bone, and it attaches to the temporal bone at a joint called the temporomandibular joint. If we cut the skull open and look at the inside of the skull, what you'll see is a view like this. So here in the middle toward the front is the ethmoid bone. And here's still some of the frontal bone on both sides. Here is the sphenoid bone. We saw a portion of that on the outside. Here's more of the temporal bone you can see from the inside. And here is the occipital bone we can see from the inside. This large hole is called the foramen magnum. Foramen means hole through a bone. And this is where the brain and the spinal cord meet. Here's the superior view of the skull. And notice you see the frontal bone. Here are the two parietal bones. And there is a suture called the coronal suture. Well, corona, right? That really means crown. And then here is a sagittal suture. It connects the left and right sides of the skull. And here is a lambdoid suture, and it attaches the parietal bone to the occipital bone. Here's another view of that lambdoid suture. Notice here's the two parietal bones. Here's the lambdoid suture. And here is the sagittal suture. The wormian or sutural bones are bones that form within sutures, and we all have different sutural bones. This is looking at the skull from the front, and notice you can see the frontal bone here, and here are the zygomatic bones, and you can see the nasal bone, which is right here, forming the bridge of the nose. Inside, I'm just going to go ahead and point out to you what we call the perpendicular plate of the ethmoid, and that separates the nasal cavity into two parts. There are other slits and holes in the skull, which we'll go over. But you'll notice here is an optic canal. That's where the optic nerve goes through. Another marking on bones are slit-like passageways. Here's one on the top, so we call it the superior orbital fissure. And this is a fissure on the bottom, so we call it the inferior orbital fissure. We're looking at the eye orbit here. And here is a lacrimal foramen. If we go back to this picture, we can see those two slits, the superior and inferior orbital fissures. And we can also see the lacrimal foramen that would come down here. So here is the temporal bone. We saw some of the sphenoid bone. We can also see the frontal bone. And here is the zygomatic bone. Notice there is a portion called the zygomatic arch. It is made up of part of the temporal bone and part of the zygomatic bone. So the arch is here. There's also a process for the temporal bone called the mastoid process, which you see here. And parts of the mandible showing are the body of the mandible, which is really the chin, goes over to the other side. The zygomatic prominence is the prominent portion of your cheekbone. There's also an external acoustic meatus or auditory meatus, and this external auditory meatus is where the sound waves come in to reach the eardrum. Here is the occipital bone, and one part you can find is the external occipital protuberance. See if you can feel that on the back of your head. Here is a view of the skull from the side. So again, we can see that zygomatic arch, and we see the lacrimal foramen, where the teeth come in, the sockets called alveolar processes. Here's the body of the mandible or the chin, and the tip of that chin we call the mental protuberance. Remember, mental means chin. Then there's an angle where this bends, and the straight up and down portion of bone is called the ramus of the mandible. If we look at the skull from the undersurface, we're going to see where it attaches to the cervical vertebra, the first vertebra. And here we see what we call occipital condyles. Condyles are rounded portions of bones. So there's a joint here called a condyloid joint. Another bone we can see is the hyoid bone. Here we see cervical vertebra, which are the first 7 vertebrae you have. We have a cervical curve, which is made up of cervical vertebra, 7 cervical vertebra. There are 12 thoracic vertebra. The ribs are attached to the thoracic vertebra. 5 lumbar vertebra. And then there's the sacrum, which you see back here, and then the coccyx. I always remember this: 7, 12, 5. 7 a.m. breakfast, 12 o'clock noon, lunch, and then 5 o'clock p.m. for dinner. 7, 12, 5. You can also see ribs here, and the ribs are part of the axial skeleton, just like the skull and the vertebra are. So here are the ribs, and there's 7 pairs of what we call true ribs and 5 pairs of false ribs. The last 2 pairs of ribs are called floating ribs. So there's 2 floating ribs that are part of the false ribs. The floating ribs do not attach at all to the front. The false ribs attach by way of cartilage to the sternum, which is here, and the true ribs attach directly to the sternum. That's all I'm going to go over for now on the axial skeleton, but there are more markings to look at.